PathPoint was founded in Santa Barbara, California in 1964 and was originally called Work Training Programs Incorporated. Early visionaries believed that all people had the ability to be self-sufficient if given the right opportunities and the right help. From the beginning days of working with unemployed adults receiving public assistance, PathPoint quickly developed an expertise in designing the right assistance to overcome the barriers that were preventing the productive integration of people with disabilities into the mainstream of community living. After an initial grant period ended, the board of directors wanted to continue the good work and capitalize on what had been learned about helping people with very real barriers to become successful workers in the local economy. The idea was simple, really. By teaching the skills and behaviors necessary for success on a job, or success in a living environment, or even successfully navigating one's involvement with the community, independence and autonomy are the result. Our vision is that all people, regardless of disability, have the right to live as independently as possible. That will mean different things for different people, but our goal is to help the people we serve find their maximum independence. Over the past decade, PathPoint has served more than 2,000 individuals annually, with a focus on physical and developmental disabilities, mental illness, and economic disadvantages. The current and ultimate objective of PathPoint is to maintain the nonprofit organization on firm footing that will permit it to continue providing the same range and quality of services for the foreseeable future. By doing so, PathPoint will remain a preeminent service provider in the fields of employment services, independent living, and community access programs. PathPoint's participants represent a diverse group of people living with disabilities and disadvantages. PathPoint's programs enable these individuals to become active and contributing members of our community. In the area of employment, for instance, the national unemployment rate for adults with disabilities exceeds 78%. Breaking down the barriers to employment is one critical means of increasing community engagement for the people receiving our services. By successfully participating in PathPoint's employment services, offering vocational exploration, job preparation, and training, program participants are better positioned to become contributors to the economic growth of our communities. PathPoint job placement services then help people take the skills and experience gained in training directly into the local job market. It is critical that these services remain available to individuals who will simply be denied the opportunity to work without them. In addition to employment, our major long-term goals are to help overcome the challenges to healthy, productive, and fulfilling lives so that they can maintain decent housing on their own, build skills such as independent living, communication, social networking, mobility, and consumer awareness. We aim to break down isolation through social interaction and realize their goals to become independent, self-sufficient, and contributing members of our communities. PathPoint has a number of key strengths that have continued to create success for the organization and the people we serve. First of all, we have very low administrative overhead, with most of the program funds going directly to the staff and facilities that are so important to the day-to-day experience of the program participants. By having well-trained and person-centered staff, the stability of the program is ensured and the satisfaction of program participants is high. The size and diversity of PathPoint means that we can constantly learn from our experiences and share best practices across program models and geographic areas. We are an organization that values change and evolution. PathPoint has a focus on quality through both the accreditation process and our own internal quality improvement reviews. PathPoint has a long history of pursuing collaborative relationships with other organizations to maximize the impact of its services. Our aim is to provide support services and to rehabilitate people with special needs wherever possible so that they can live in the community on their own. PathPoint offers the largest and most comprehensive range of services in Central California, including employment services, day programs, and residential programs. Through its development department, PathPoint pursues various avenues of support to leverage funding and to sustain its operations. These include solicitations by board members, annual appeals, employer matching gift initiatives, fundraising events, solicitations to corporations and service clubs, and others. PathPoint has recently initiated a planned giving program and pursues an active year-round grant writing calendar. In addition, PathPoint's website, newsletter, email blasts, and social media all offer opportunities for family members, supporters, and the public to donate to PathPoint. Through these avenues, PathPoint leverages and stretches every dollar to its maximum effect. PathPoint takes pride in its tradition of high-quality, professional, and outcome-based services for people with disabilities and disadvantages. PathPoint's programs are guided by person-centered thinking and planning. PathPoint is committed to doing more than just consistently and successfully keeping people healthy, safe, and ensuring basic rights. Our program participants and their families are actively involved in creating individual service plans to outline activities, incorporate interests, and set customized goals. People with disabilities and disadvantages benefit from the opportunity to find their voices, to overcome stereotypes and obstacles to their employment, and to achieve self-reliance. With the support of PathPoint staff and their community, they develop their own personalized path to personal independence. To maintain high-quality, professional, and outcome-based services, PathPoint surveys 5 stakeholders: program participants, families, funding agencies, employers, and staff. The information received in this process allows PathPoint management to respond to suggestions and to implement changes to improve services and increase satisfaction of our stakeholders. This process ensures that our philosophy of person-centered thinking permeates our services and programs. It allows us to safeguard personal choice and appropriateness of our offerings, curriculum, training, access, and opportunities for our program participants, family members, community partners, and funders. PathPoint has a distinguished history of achievement, good management, and stable financial conditions. PathPoint is governed by an all-volunteer board of directors, 100% of whom make financial contributions to PathPoint. PathPoint's strategic plan incorporates fiscally sound business practices to sustain the organization. Financial sustainability is measured by standard accounting practices, namely that PathPoint brings in enough money to cover costs. This financial sustainability is a necessity. The ability to maintain its services while maintaining its reputation for excellence is a core measure of success. PathPoint has been assigned a low-risk audit, and this rating has been maintained over many years. In PathPoint's mission and values statement, we identify a commitment to continuous improvement and a passion for providing quality, results-oriented services. We undergo an external audit by the Commission on Accreditation of Rehabilitation Facilities. Recently, PathPoint achieved their highest level of award, a 3-year accreditation. This honor has been bestowed on PathPoint repeatedly. In addition to sound business practices, we also measure individual growth and achievements of program participants. PathPoint employs multiple measures of program effectiveness. We evaluate the impact of all our programs by documenting changes in the quality of the lives of our service recipients and their families. Each program participant receives an initial comprehensive assessment that is continually updated with the participant, their family members, PathPoint staff, and mandated state or county case management agency. In the course of carrying out its mission, PathPoint encounters a lack of information and awareness regarding the social and economic status of non-institutionalized people with disabilities in the United States, and particularly California, our service area. While many of us take our health, independence, mobility, and employment for granted, in the United States, there is a large and growing segment of our population who needs special assistance to survive each day. The general populace remains unaware of the various categories and extent of disabilities according to the Disability Status Report for the United States published by the Employment and Disability Institute at Cornell University. The prevalence of a disability in the U.S. was 12% for persons of all ages and significantly higher for seniors. These figures clearly demonstrate the need for specialized, community-based programs and services for people with disabilities. The need for services has been underestimated by the general population. Also less commonly known has been the realization that community-based programs like PathPoint are cost-effective and preferable to the far more expensive and dispiriting alternative of institutionalization. Although fairly well known as a provider of employment services for adults with developmental disabilities, for over a decade our Ventura County Division has provided the Youth Network Services Program in conjunction with the Ventura County Workforce Investment Board. This program offers vocational training, educational opportunities, internships, social supports, financial assistance, and leadership training for at-risk youth. Every year, hundreds of youth receive benefits from this program. Finally, PathPoint is the contracted service provider for the Senior Community Service Employment Program in Santa Barbara, San Luis Obispo, and Los Angeles counties. Participants must be 55 and older and meet income eligibility requirements. Seniors who need to refresh their skills to re-enter the workforce are placed in part-time community service positions with a grant-funded salary. They serve the community at libraries, hospitals, senior centers, local nonprofits, and other local organizations. After gaining on-the-job training, CSEP staff assists the individual make the transition to an unsubsidized position in the local community. Hundreds of seniors have been helped through the program. PathPoint has received many awards throughout its more than 45 years of existence. We've recently been awarded the 2011 Goleta's Finest Nonprofit Award and recognized for our emergency preparedness programs, as well as our Youth Network Services program. We received the San Fernando Valley Business Journal Award for the Best Managed Business Organization and an Outstanding Community Partner Award from the City of Santa Barbara. We frequently receive letters and thank you notes from program participants, such as this recent note. PathPoint has been so good for our daughter Lisa. The whole organization has been exceptional right from the start. First, they worked with us to make sure she got the right job, and whenever there were problems, they helped us work through those. Lisa has really blossomed at PathPoint and never wants to leave. We couldn't be happier. Thank you so much. Parents Bill and Elaine wrote about their son Andrew. Andrew has autism, and he is doing better at PathPoint than he has ever done in his whole life. He's calmer and more focused, and he's learning new things that are helping him have a fuller life. Andrew always has a happy smile on his face when we visit him there, so we know that he feels secure and cared for. Thank you so much for the wonderful work that you do. While awards help us to assess the effectiveness of our programs, the changes in the lives of program participants are the most compelling insights into the benefits and success of our programs. PathPoint's mission is based on the belief that low-income individuals, especially those with disabilities and disadvantages, can achieve self-sufficiency if the proper supports are in place. For example, in order to achieve stability in housing, people must be able to pay their rent and be able to maintain personal independence. In order to pay rent and still have money left over for other essentials, people need jobs. To live independent and full lives, people need the support of staff to learn daily living skills, money management, and decision-making skills. While pursuing its mission, PathPoint participants and staff have confronted stereotypes and preconceived notions regarding the abilities and potential of program participants. People with disabilities, whether developmental, physical, or mental, have frequently been misunderstood by the public. PathPoint has been actively engaged in educating the public about individuals with disabilities. PathPoint has been actively engaged in educating the public about individuals with disabilities. And of course, as with any basic needs organization, the demand for PathPoint services has outstripped the resources available to provide that assistance. It is a fact that our society has rightfully prioritized people living in their home communities and not living in state-run institutions. That is a good thing. But with more and more vulnerable people living in the community, PathPoint services are spread very thinly. Ensuring that our program participants are safe and moving forward in their lives is our #1 goal. People with disabilities and disadvantages and their families have not had access to the community and its resources to effectively communicate their needs. To counter these obstacles, PathPoint has supported self-advocacy for individuals with special needs. We have supported local, grassroots efforts to empower individuals to advocate for themselves, to speak out and advocate for change on their own behalf. In order to remain a professional and viable nonprofit organization, PathPoint needs to maintain its infrastructure, sustain its programs, and pursue new cutting-edge programs and services. PathPoint has a continuing need for capital items of all types. In our transportation services, we use vans that provide a ride to and from work sites when individuals are unable to use public transportation due to the severity of their disability. Many times, these vans need to be adapted for wheelchair use. Our training facilities have computer labs for skill training, and the upkeep and replacement of computers is an ongoing expense, as is our use of technology for staff. PathPoint facilities must be kept in decent, safe, and attractive condition, which requires regular maintenance and upkeep. In serving more than 2,000 people per year, PathPoint must maintain and upgrade curriculum. Programs are transcending their previous level of service, interaction, and stimulation with the use of new technology. Staff members report they feel on the verge of a complete paradigm shift, working on developing communication applications for portable notebooks. Staff members' dedication to providing the highest quality of service and tools possible is only limited by the costs of new equipment and the training required to implement new programs. PathPoint anticipates expanding its focus on increasing the community's involvement with our mission. Continuing to leverage community participation will provide a platform for sustained success for the organization and for the people who rely on our services into the future. Every day, PathPoint is turning away people who need our services. Just recently, we had to severely restrict the number of people in our job development pool. Our resources were simply overwhelmed. So the restriction of services has created a gap that no other agency has had the resources to fill. In fact, PathPoint is the last employment services provider left in some of our geographic areas. That's an example of an existing service that has had to be restricted. Additionally, there are support needs that provide a more holistic approach to an existing service. For instance, in PathPoint Senior Employment Services, at any given time, about 15 to 20% of our seniors are living in their cars or at a shelter. They need a broader scope of services to address housing, substance abuse, or financial management than is available through our one funding source. And yet, dealing with those needs at the same time as talking about work and providing that work experience is crucial to the ultimate successful reentry into the workforce. That would be a wonderful leverage of an existing government program to ensure greater outcomes. But PathPoint does not have the resources available to fill that gap. And finally, there are other populations entirely that could benefit from the expertise PathPoint has gained over the years in overcoming barriers to productive community living. Right now, we have veterans returning home with rehabilitation needs. We have homeless populations who are living and dying on our streets. We have young adults without a high school education who need to find the skills and attitudes that will give them a chance at success. And the list goes on.